In this video, I'm going to use a model of the heart to demonstrate the anatomy of the heart to you. You are looking at an anterior view of the heart. So if this was my heart and you had cut open my body wall, this is what would you see, obviously a very, very large heart. Now clearly my heart isn't this size. Our hearts are about the size of a closed fist. Now I'm quite a small person, I've got a small fist, so my heart is going to be about the size of this fist. Now this model shows you the different parts of the heart. So if I go through these with you, so as you look at it, first of all, this is the right ventricle that you can see. This is the right auricle on top of the right atrium. Left ventricle, left auricle sitting on top of the right, so on top of the left atrium. We've got anterior interventricular groove, or the sulcus, which contains a coronary artery and some of the coronary veins. This grey-looking vessel that you can see coming at the front is a pulmonary trunk, which splits into the pulmonary arteries, and sitting immediately behind it, this curved structure in pink is the aorta, and you can see some of the branches which are coming away from it. The other thing that you can see quite clearly on this heart are the branches of the coronary arteries, which are shown in this pinky color, and then the coronary veins, which are shown in this gray color. So this is what you see at the front of the heart. Now, if I turn the heart around, I want you to see, first of all, here is the superior vena cava, which is going to be bringing deoxygenated blood into the right atrium from the upper half of the body. And then at the bottom here, we've got the inferior vena cava, which will be bringing in deoxygenated blood from the lower half of the body into the right atrium. The other vessel I would like you to notice is this one here. This is the coronary sinus, which brings the deoxygenated blood from the heart itself to the right atrium. You can see all of these coronary veins. They all come together and open up into this large vessel, which is a coronary sinus. That's going to be draining the deoxygenated blood from the heart into the right atrium. So the right atrium contains or receives deoxygenated blood from three sources: from the coronary sinus, which is the deoxygenated blood from the heart itself, via the inferior vena cava, deoxygenated blood from the lower half of the body, through the superior vena cava, which is deoxygenated blood from the upper half of the body. I have removed the pulmonary trunk and the aorta to show you the semilunar valves, which lie at the base of these two vessels. If I turn the model around a little bit, you can see at the base of the pulmonary trunk three little flaps. These are the flaps of the pulmonary semilunar valve. And then immediately behind it you can see the aorta, and once again you can see the three flaps of the aortic semilunar valve. They are called semilunar because each flap is shaped like a half moon. These valves allow the blood to flow out of the ventricles but prevent the blood from coming back into the ventricles. So the pulmonary semilunar valve, when the right ventricle contracts, the blood flows through the pulmonary trunk, but when the ventricle relaxes, it prevents the blood from coming back down again into the ventricle. Similarly, with the aortic semilunar valve, when the left ventricle contracts, it opens, lies flat, blood flows out, but when it relaxes, it prevents a backflow of blood back into the left ventricle. The other thing that you can see quite clearly in this model here, if you look at the base of the aorta, you can see the two branches of the two coronary arteries. So these are the coronary arteries which arise from the base of the aorta, and they take oxygenated blood to the heart itself. This is part of the coronary circulation. I have now removed the front part of the heart in this model so you can see the internal structure of the heart. Superior vena cava, this is the right atrium, right ventricle, left atrium, left ventricle. Note that the right-hand side of the heart is completely separate to the left-hand side of the heart. The two sides are separated by this thick muscular wall called the septum. This is called the interventricular septum in between the ventricles and the interatrial septum in between the two atria. You will notice that in between the atria on both sides and the ventricles, there are these valves. They are called the atrioventricular valves because the valves are between the junction of the atria and the ventricles. The valve on the right-hand side is called the tricuspid valve. It has 3 cusps. It allows the blood to flow from the right atrium into the right ventricle, but when the right ventricle contracts, the valve closes up and prevents the backflow of blood from the right ventricle back into the right atrium. Similarly, on the left-hand side, we have a valve between the left atrium and the left ventricle. This valve is called the bicuspid valve because it has 2 cusps or 2 flaps only. It is also sometimes referred to as the mitral valve because somebody thought the shape looked like the mitre, which is the name given to a bishop's hat. So once again, the blood flows from the left atrium into the left ventricle. When the left ventricle contracts, the valve closes, preventing backflow of blood from the left ventricle back into the left atrium. Note the valves are held in position by these cords. These are called chordae tendineae. They anchor the flaps in place to prevent them from blowing inside out. These are what we literally call our heartstrings. Okay, literally our heartstrings.